And today, dozens of nurses and advocates rallied at the state capitol for the passage of the Patient Safety Act.
Yeah, the Pennsylvania House Health Committee also held a hearing this Tuesday on this measure, which would limit the number of patients for nurses. Erie News Now state capitol correspondent Brendan Scanlon heard from those who are for and against it.
Today in Harrisburg, nurses and advocates rallied to address an ongoing crisis.
They felt overworked, they felt stressed, they felt unsafe in their working environments. They didn't trust their administrators, and they're like, I can't do this, I'm leaving.
Eileen Kelly is a former nurse. She, like many others, could not continue working in what she calls unsafe conditions, both for nurses and their patients.
We were responsible for way too many patients than any one nurse could safely manage. We don't have a shortage of nurses, but we do have a shortage of nurses that are willing to work in unsafe conditions.
Kelly believes the Patient Safety Act is the solution.
This will save lives, save money, and be the answer to the workforce crisis we have right now in healthcare with nurses.
But opponents are concerned about the mandated ratio and the thousands of dollars in penalties for failure to comply.
Unfortunately, what this bill would do is mandate a certain ratio of nurses in a hospital.
Representative Kathy Rapp says it poses a threat to many hospitals that might not be able to meet the ratio, especially in rural areas.
I want more nurses in our hospitals, but I don't want to see our hospitals fined to the point where they have to close beds and possibly close their door.
And advocates like Kelly tell us the bill could actually save hospitals money because of increases the quality of care, meaning less readmissions and other complications.
And you can find more on our website. You could just head to erienewsnow.com and click on this story.
And